Okay, this is going to be a hinged elbow cast. I'm going to start off with some stockinette. This is going to be a little bit different stockinette than, say, the long arm cast, but what I am going to do is roll a long arm cast. You can use a number of, there's a number of indications for this cast, but mostly going to be interarticular elbow fractures. You can use it for MCL and LCL injuries as well. As opposed to doing one giant long stockinette all the way to the tips of the fingers, we're going to cut this one to have two separate pieces that overlap just a hair. Your parameters for this are going to be the same as a long arm cast. They're going to be 2 finger widths below the axilla, angling towards a greater tuberosity, and then slightly below the metacarpal heads with a little bit of pronation, slight pronation. 90 degrees at the elbow. Hopefully I'm not in your way. You're going to mold around the humeral condyles similar to a Munster cast or a Sarmiento cast. Your cutouts will be the same as a Sarmiento. Keep an eye on their position. And see how the patient wants to come out and help me? I actually want him in, like they're going to carry their arm the whole time. And the reason for that is their soft tissue is going to change when they bring their arm up. And then your parameters will be off. And I'm going to angle towards his greater troch. Give a little extra padding to the olecranon. And you pretty much just want 2 or 3 layers of the whole cast, and that's perfect. Cut almost all the way through the web space. And this doesn't have to be real thick because you're going to create a money roll way after the fact that it's dry. And I'll show you what I mean in just a few moments here. See how I angle up my fiberglass? Give a little bit extra. I know exactly where my molds are going to be. They're going to be right here. So I give a little extra fiberglass there. And now I'm just going to hold position. Slightly pronate. 15 degrees of dorsiflexion. Right above his humeral condyles. That's what I'm looking for. Here's his condyles. I mold right above them. This will take about 3 or 4 minutes to set. Should be able to get a good glimpse of those molds. Perfect. So when you cut this out, you're leaving your molds in. So you're going to cut out on the outside flare of the mold, come up to allow full flexion. First thing I'm going to do before I do the cutout is I want to make sure I get my hinge in the right place. So once I'm for sure set that this isn't going to move, I like it. Now your hinge needs to make contact with the cast. And also nice thing about these molds is that tells you where the joint is. Right below those molds is exactly where the center of this hinge needs to be. You want as much contact as possible with that hinge. You don't want the hinge to make contact with the skin. You actually want a little bit of a gap. And that's it right there. And if the elbow's at 90 degrees, your hinge needs to be at 90 degrees. That's perfect there. Now you can use tape to hold this in place. What I like to do is just kind of mark, which I don't think I have a pencil or something here. I just like to mark where this hinge goes. That way you don't ruin your placement in your supination and pronation. And that should be pretty good there. Okay, now I'll trim this out. Definitely want to leave as much padding in there as possible. Remember how I made two different stockinette pieces? This is where that pays off, because you technically now have two separate casts. And you can mess up supination and pronation. That's why you mark your cast, or you mark where the hinge goes. And I'll start with the top part first. Just like any cast, you want what they call a bed of fiberglass down before you add things to it. And finish it up by adding my hinge to the short arm portion. Make sure your rotation is right. Hinged elbow cast, full extension, full flexion. Again, MCL, LCLs, interarticular elbow fractures.